7 warning signs of colon cancer you shouldn't ignore. Colon cancer, also known as colorectal cancer, occurs when abnormal cells in the colon or rectum grow uncontrollably. It typically begins as small, benign clumps of cells called polyps, which can develop into cancer over time. But here's the good news. It's one of the most preventable forms of cancer. Let's uncover the silent signals your body might be sending and learn why early detection is your best defense. Just a quick reminder, this video is for educational purposes only, so to speak to your doctor if you have any medical concerns. Symptom 1. Abdominal pain and cramping. Abdominal pain and cramping are common symptoms of colon cancer, but can also be caused by other conditions like gas, indigestion, or constipation. Colon cancer-related pain typically occurs as a tumor grows, blocking or narrowing the intestine, which can lead to a backup of stool and gas, causing discomfort and pain. Bloating or a feeling of fullness after eating small amounts may also accompany this pain. While not all abdominal pain is due to colon cancer, persistent or severe pain, especially when combined with symptoms like changes in bowel habits or unexplained weight loss, should be evaluated by a doctor. Early detection of colon cancer can improve treatment outcomes, so don't ignore ongoing abdominal pain or cramping. If you're concerned, seek medical advice promptly. Symptom 2. Blood in stool. Blood in the stool can vary based on the source of bleeding. It might be bright red or dark and sticky, indicating different locations of bleeding in the digestive system. Bleeding from colon cancer can be intermittent and sometimes not visible to the naked eye, requiring tests to detect it. Not all colon cancers cause bleeding, so even if you don't see blood, it's important to be cautious. If you notice blood in your stool or on toilet paper, consult your doctor. Tests like a colonoscopy can determine the cause and guide treatment. Don't ignore bleeding or assume it's harmless. Early detection of colon cancer can greatly improve recovery. Prioritize your health and seek medical advice if you notice bleeding or other concerning symptoms. Symptom 3. Unexplained weight loss. Unexplained weight loss refers to a significant decrease in body weight without any intentional effort, such as changes in diet or exercise routines. In the case of colon cancer, unexplained weight loss often occurs as the tumor grows and affects the digestive system's functioning. The cancerous growth may impair the body's ability to absorb nutrients from food properly, leading to weight loss. Additionally, the body may also break down muscle tissue and fat stores to provide energy, further contributing to weight loss. It's essential to pay attention to unexplained weight loss, especially if it's significant or occurs rapidly. Losing more than 5% of your body weight within a few months without trying could indicate a problem that requires medical attention. Symptom 4. Fatigue and weakness. Fatigue and weakness often develop as colon cancer progresses and affects the body's overall functioning. The tumor can disrupt normal bodily processes, leading to fatigue and weakness. Additionally, as the cancer grows, it may cause internal bleeding, resulting in anemia. It's a condition characterized by a low red blood cell count. Anemia reduces the blood's ability to carry oxygen to tissues and organs, leading to fatigue and weakness. Furthermore, the body's immune system may mount a response to the cancer cells, which can consume significant amounts of energy and result in fatigue. Plus, the emotional and psychological toll of dealing with a cancer diagnosis and treatment can also contribute to feelings of fatigue and weakness. While fatigue and weakness can have various causes besides colon cancer, it's essential to address the underlying cause. Whether it's colon cancer or another condition, you can take steps to improve your overall well-being and quality of life. If you're finding this information useful, please hit the like button, subscribe, and turn all notifications on to stay updated for my latest health and nutrition tips. Symptom 5. Anemia. In cases of colon cancer, the tumor or growth in the colon or rectum may bleed slowly over time, leading to chronic blood loss. This ongoing loss of blood can result in a gradual decrease in iron levels in the body, eventually leading to iron deficiency anemia. The blood loss may not always be visible, as the bleeding can occur in small amounts over an extended period, resulting in subtle symptoms that are easily overlooked. Symptoms of iron deficiency anemia can include fatigue, weakness, pale skin, shortness of breath, dizziness, and cold hands and feet. These symptoms occur because the body's cells and tissues are not receiving an adequate oxygen supply due due to the decreased number of red blood cells. It's important to note that iron deficiency anemia can develop slowly over time, and symptoms may be nonspecific or attributed to other causes. However, if left untreated, iron deficiency anemia can lead to serious complications and negatively impact overall health and quality of life. Symptom 6. Nausea and vomiting. In the context of colon cancer, nausea and vomiting may occur as a result of various factors related to the disease and its effects on the body. For example, as a tumor grows in the colon or rectum, it can obstruct the normal flow of digestive contents, leading to bowel obstruction. This obstruction can cause a buildup of food, fluids, and gas in the intestines, resulting in symptoms such as abdominal discomfort, bloating, and nausea. In some cases, nausea and vomiting associated with colon cancer may be triggered by other factors, such as chemotherapy or radiation therapy used to treat the disease. These treatments can cause gastrointestinal side effects, including nausea and vomiting, as they affect healthy cells in the digestive tract. Seeking prompt medical attention is crucial for determining the underlying cause of nausea and vomiting and ensuring appropriate management. Symptom 7. Rectal bleeding. Colon cancer-related rectal bleeding typically occurs as a result of bleeding from a tumor in the colon or rectum. The blood may appear bright red, indicating fresh bleeding from the lower digestive tract, or it may appear darker if the bleeding is higher up in the digestive system. However, it's important to note that not all colon cancers cause rectal bleeding, and the absence of bleeding doesn't rule out the possibility of cancer. Persistent rectal bleeding should always be evaluated by a healthcare professional, as it may indicate an underlying health issue that requires prompt attention. While occasional rectal bleeding may not be cause for alarm, persistent bleeding or bleeding associated with other symptoms warrants investigation. In the context of colon cancer, persistent rectal bleeding may be accompanied by other symptoms such as changes in bowel habits, abdominal pain, or unexplained weight loss. This combination of symptoms can be concerning and should prompt further evaluation. So it was all about my today's video. Thank you so much for watching. Like is always appreciated, and remember to subscribe and tap the bell for more videos.